It is never too late to expand the mind of a person on the autism spectrum. A quote by Dr. Temple Grandin. The CDC estimates that 1 in 59 children by the age of 8 were diagnosed with autism in 2014. Autism spectrum disorder is becoming a much more commonly recognized disorder in which we must educate. Autism spectrum disorder has many effects on students in an educational school setting. I have been employed in a classroom of students with disabilities for 6 years, and I have researched, observed, and experienced educating students on the autism spectrum. First, I will identify multiple challenges autistic students encounter during a typical day at school. Then we'll talk about potential aids that students could find helpful. And lastly, we'll discuss long-term effects that students with ASD may have. Autism spectrum disorder, again, has many different effects in an educational setting. An umbrella definition for autism could be a delay in one's ability to communicate and interact socially and include the act of repetitive behaviors or restricted interests. According to an article on raisingchildren.net, children need the skill of joint attention for developing communication and language skills. For example, if I point to a cat and the student is looking somewhere else, it'll be harder for that student to connect cat with the word cat. Now, this type of impairment makes learning at school very difficult. There are numerous learning obstacles and focus stealers, per se. The attention span for autistic children is extremely limited. Also, according to raisingchildren.net, many children behave in difficult ways. Children can behave aggressively towards themselves or other people. Behaviors can include things such as scratching, biting, even bite themselves. Some will throw things such as chairs and tables, finding increased strength when upset. And some children will choose to completely evacuate the environment. Oftentimes, these outbursts are caused from a lack of communication. Other causes can range from difficulty managing frustration to not getting their needs and wants met. Behavior of this sort affects a student in an educational setting because they can become so absolutely distraught, they can be lethargic or never fully calm down, causing their brain to be unable to learn new information. Students with ASD have repetitive behaviors or restricted interests. Behaviors like this can include the hand flapping, jumping, stimulatory noises, and restricted interests could mean a particular obsession with street signs, numbers, the dictionary, a routine. Interest could be anything, but show extreme knowledge or interest in one particular space. These impairments can have effect in a school setting when, according to a research article written by Rosie Vaughn, she stated that repetitive behaviors are a hindrance to student learning because the need to move is more prevalent than the information being taught. We've identified a few challenges. Now let's talk strategy. According to a study by Ashley Davis, the first strategy is visual aids. Visual aids can include a visual schedule to show the child when something is going to happen. This can reduce outbursts and help in preparedness for transition times. Using a visual aid to communicate can also be helpful. Exchanging pictures of objects or activities can aid the student in telling the teacher if they need to use the restroom, if they need a break, if they need a snack, or if they're just ready to move on. Davis also says academics, specifically comprehension, can be difficult for children with autism. Visuals aid in chunking material to break them into smaller parts. Doing a picture walk before you read the book can be a helpful tool in storytelling. Davis states that another aid can be just keeping a simple routine. Routines provide predictability for students. Knowing what's coming next can be particularly helpful to a child with autism. Having consistent daily routines is a good idea with any child. Autism spectrum disorder children become dependent on routine to guide them through their day. So we've talked about challenges, we've talked about a couple helpful tools. Let's talk long-term effects. Few studies have been done on this. However, in a study conducted by Davis, she found that most skills obtained were merely life skills. Brushing your teeth, going to the bathroom, fixing a meal. Some high-functioning students were able to live independently, but were not without struggle when it came to employment or social interaction, even into adult life. Davis also states that students with a lower functionality were able to complete daily routines, but were unable to live alone and required assistance with things such as, but not limited to, grocery shopping, driving. this point, we've talked about some challenges that kids face. We've talked about some potential tools, and we've talked about long-term effects that students with ASD may encounter. Autism spectrum disorder has many effects on a student in a school setting as well as later on in life. In conclusion, autistic students struggle in education, potentially lasting into adulthood. Autism spectrum disorder affects a child's ability to learn, socialize, and complete daily life. Thank you.